Ja, herzlich willkommen zu einer neuen Ausgabe vom SI-Talk und bei mir habe ich meine erste Cannabis-Story. Zweiter Tag, erste Cannabis-Story. Habe mich eigentlich gewundert, warum das so lange dauert, aber es liegt wahrscheinlich an der Rohstoffkonferenz, da gibt es halt relativ wenig Cannabis-Stories. Emerald Health hat $8 Stock, also nichts mehr, kleines. Und neben mir ist Ihr CEO, and?
No, I'm executive chairman.
Executive chairman.
Yeah.
It's interesting. We in Europe, we don't have this chairman, executive chairman, and so on. That's different model. That's North American style. But this is not the important thing. The important thing is the cannabis sector. The cannabis and the Germans are going deep into the German in the cannabis sector. The Germans allowed last year that the medical side of the cannabis is also allowed now in Germany, and you are in this medical side. But Canada is in a big shift this year from medical side to recreational side. So. As your company now in the medical side, how it's affect you that's now it's going legal for everybody?
It's a great opportunity. You know, I'm a medical doctor by
Yeah.
training, and as you said, you know, it's not about titles. It's about the Canadian sector as well as, you know, Emerald as a company. And Emerald's very much focused on medical product development. That's why, you know, my team and everybody came into this. But you know, the government changed and the recreational market has become available. So Canada is going to become the second country in the world to federally allow recreational cannabis. So that's exciting. That means, you know, there's a great opportunity to make plenty of money to be able to support what we want to do on the medical side.
Do you believe this? So many stocks are coming out, and I believe when it's legal for everybody, that maybe in the end we will see a consolidation also in the market. Do you see that? Do you have the same feeling that maybe in the next starting in 6 or 9 months when the market is open, that we see a consolidation in it?
Yeah, and we're already seeing it. You know, coming back to the concept of Canada being leading. You know, it's great that Germany's coming on board, and one by one, lots of countries are coming on board for medical, right?
Not Austria so far, I must say.
Well, some people are a little slower, right?
Yeah, that's.
Right.
We are well known for this.
So yeah, no, it's great. You know, you're at the right place at the right time. You know, especially as you watch the German market evolve. You know, for sure, German market will go into recreation, you know, over time, right? But Canada provides a great model, right? So from a federal all the way down, you know, when you go down to the U.S., you see how messy it is when the federal feds are not on side. But yeah, so no, it's a great opportunity to be able to, you know, provide a range of products, not only in Canada, but on a global basis. Remember, we can send product to Germany, and there's a lot of companies that have formed alliances. So, yeah, Canada has the biggest companies already. You know, we have, you know, $2 billion, $4 billion, $8 billion companies already, and those companies are, you know, effectively out there looking for other opportunities. So, you know, we're in the top 12 companies in Canada. We continue to look for M&A as well.
Okay, when we come to, there's a lot of speculation on how big maybe the Canadian market is. Is there any serious number what we can say, okay, from the revenue side or something, this is a realistic number?
You know, it's a great question, right? So when you look at, you know, smart people like Deloitte, you know, doing research, you know, they publish a report that says, you know, the cannabis market maybe 6 or 8 billion, you know, but with all the peripherals, you know, it could be 22 billion. So it's a, you know, it's a broad range, but, you know, one thing we know, it is big, right? On a global basis, we know the black market is over $200 billion, right? So there's that market that's going from black to white, but you know, but underneath it is what happens to this market when it becomes legalized? What happens when you can use this product, legally? I think there's an opportunity for, exponential growth, right? People, our relatives, our parents, our brothers and sisters may end up starting using this product if it's legal, if it's okay. Look at the expansion of the alcohol market, after prohibition ended.
Do you see also that from a company from outside coming and take a portion of the area, especially I would say tobacco companies, or that they are interested in the market to step in? Then tobacco is for me the realistically fit for them. They have the distribution ways. They can form it as a cigarette.
Yeah.
In Switzerland, there's you can buy cannabis cigarettes like a pack, like a cigarette you buy from tobacco.
Yeah.
So and maybe also the guys are leading. They have big and deep pockets, so that they can invest into the sector.
Yeah. When we started the company, again, just to digress for a second, I'm a medical doctor. When I became a venture capitalist, come from the healthcare industry. I'm an executive of a number of healthcare entities that I've built over the last couple of decades. So, the model there is, it's not, the Mercks and the Pfizers that necessarily invent everything. It's small companies, right? They invent it,
And the biggest...
Yeah, they come in there, they buy you, right? Or they invest in you, or they give you royalties. So it's exactly the same model. I mean, when we came into the industry, we saw this massive opportunity where the big money has to sit on the sidelines because they don't want to tarnish your name. So it's entrepreneurs, like us, that are able to go in, build businesses for these people when they come in. And we've already seen, one entity in the United States, Constellation Brands, invest $250 million into the Canadian market. That's a great validation. But you're absolutely right. So it's not just alcohol companies. It's not just tobacco companies. It's not just nutritional companies. And it's not just pharmaceutical companies. It's all of them, right? They're going to be looking for products in this industry. So it's really exciting to be able to build a solid company that they're going to want.
It is a big market. So it's necessary that they look for them, these big companies, and now when it's legalized, then there is the starting point they can look it for. Before it's not, when it's not legal, you cannot go in.
Yeah, it comes back to that earlier question you asked, how big is the market, right? How can you tell what the market is if it's, if you don't have an opportunity to, just think about how many products that are going to come out of. So whether you look at the recreational side or you look at the medicinal side, right? Yeah. There's literally an infinite amount of products you can make, right? It's no longer about growing and drying and rolling a joint, right? Mm-hmm. You have edibles, you have consumables, you have pills, you have capsules, you have creams. All of those things were not available, right? Mm-hmm. These things are being. Remember, one company alone, GW Pharma, they came up with a pill for treatment of epilepsy in children. That one product that never existed before in terms of oil for use in that purpose, it's going to be $1 billion product, right? So they created that market for them by doing a clinical study. So just imagine how this market is going to evolve.
So in the end, we can say the only what we know is that it's huge.
It's huge, yeah.
But we have no clue how huge it really is.
Yeah, and I think when you look at all the medical benefits and all the recreational benefits relative to alcohol, it's going to be huger than huge.
So, and you are well prepared to take use of it, this market.
Absolutely.
So
it's about people. It's about having money. We've got all the capital available to us in the world. We have an amazing team of people that have been in the nutraceutical business, have been in the pharmaceutical business, have been in the retail business, have launched products in all sorts of areas. And all we're doing is, we're not reinventing the wheel. We're just bringing that expertise from another area and over into the cannabis.
Brings me to the share structure. How many shares are outstanding, and how many shares have the management or the close friends to the management? So how the share structure looks like?
Yeah, we have a nice structure. We have 107 million shares out of that. Close to 60% of that is controlled by a single shareholder plus management. So it's great to see that kind of commitment, right, where you have a great deal of ownership. And so when you have that much ownership, then you're really interested in building the company because it's not a trade anymore.
And you say you are interested in M&A, as you're looking for.
Yeah.
So you're looking more, on which side you're looking more for the growers? What is really what you're looking for?
So, you know, one of the things about our company is one of the biggest potential growers in the world already. We are retrofitting 1.1 million square feet of a greenhouse, tomato greenhouse. That's 19 football fields, okay? Probably 19 soccer fields too, right? But I don't know if they're the same size.
I think they have nearly the same size, or maybe football court is a little bit bigger than the soccer. I don't know.
Oh, yeah, close enough. But then you know, in addition to that, we could retrofit another 3.7 million square feet. That would give us 5 million square feet. That would be enough to grow more than 300,000 kilograms. That would be over $3 billion of product, you know, almost half the supply of Canada. So we already have large-scale capability, you know, being built out. We're going to have large-scale extraction. But I think that where the real value that we add is in end product. You know, we're going to think about what kind of product would you use if you were to use it? What kind of product would you know, our parents use and so forth? You know, if they were going to use it. So delivery, dosage, quality, you know, is what really matters. You know, when you look at your iPhone, you know, you don't look at it and say, you know, I wonder how it was manufactured. You look at the end product, right? So we want to really focus on in the medical side, science, evidence-based, clinical trials. You know, on the recreational side, make sure that we have quality products that people can know, you know, that it came from a great source.
Sounds interesting. Thank you for the first introduction into your company. Ja, kurze Zusammenfassung. Wie gesagt, wir wissen, also eines wissen wir sicher, wir wissen nicht, wie groß der Markt ist. Wir wissen nur eines, er ist groß. Aber wie groß können wir erst sagen, wenn der Markt natürlich sich etabliert hat. Denn, und er hat einen sehr guten Punkt gemacht, es gibt sehr viele Produkte, die es bis jetzt, oder Produkte werden entstehen, die es bis jetzt noch gar nicht gibt. Das fängt natürlich an ja, er hat ja zum Beispiel eine Pille, also eine Medizin angeführt, die wahrscheinlich 1 Milliarde Marktkapital, also Volumen hat, die hat es einfach noch nicht gegeben. Und genau diese Produkte, ob das jetzt auf der Konsumentenseite sind, das fängt bei Kekse an bis Gummibärchen, was auch immer, diese Produkte hat es vorher nicht gegeben und die werden sich jetzt erst etablieren. Und deswegen kann man eigentlich nicht genau sagen, wie groß der Markt eigentlich ist. Wir wissen nur eines, er ist sehr groß. Und er könnte vielleicht sogar größer sein, als die meisten erwarten. Ich habe dann gesagt, wo wollen Sie denn wachsen? Ich meine, die Company hat ja über 100 Millionen Aktien draußen, 60% sind in sehr guten Händen eines Aktionärs und dem Management-Team. Das heißt eigentlich, die Company kann nicht übernommen werden, ohne dass die es wollen. Und die Marktkapitalisierung ist ja über 800 Millionen, das heißt, da ist schon tatsächlich etwas vorhanden. Und Sie haben ja bereits jetzt schon 1 Million Feeds, das sind ungefähr 19 Fußballfelder. Größe haben Sie bereits ein Gewächshaus. Sie können das erweitern auf über 5 Millionen. Also das sind irrsinnige Möglichkeiten, was daraus kommt. Das sind 300.000 Kilos können Sie daraus produzieren. Also unglaubliche Größenordnung, die da entstehen können. Und das könnte ja alleine 2 Milliarden vom Volumen her sein, das nur in diesem Bereich des Wachstum und des Cannabis selber ist. Allerdings, einer Fokus ist halt einfach, und er ist ja Mediziner, dass man halt einfach gewisse Standards macht und die Leute einfach ein Produkt zur Verfügung stellt. Also nicht nur, dass man einer das Gras sozusagen aus Trockenprodukt zur Verfügung stellt, nein, das Endprodukt, das dann der Konsument nutzt, egal in welche Form es auch immer ist. Es muss einfach gewisse Qualitätskriterien haben und das ist bei vielen anderen Companies, die ich derzeit eigentlich vermisse, die nutzen das eigentlich noch nicht so. Und deswegen bin ich eigentlich relativ gespannt, was die Company so in Zukunft macht. Und wie gesagt, in ein paar Monaten ist es soweit, dann ist es in Kanada erlaubt, auch privat für den Freizeitgebrauch Cannabis zu nutzen und erst dann werden wir sehen und wahrscheinlich erst in 2-3 Jahren, wie groß der Markt wirklich ist. War ein spannendes Interview, wird nicht mein letztes sein im Cannabissektor im Jänner hier im Vancouver 2018, aber es war auf jeden Fall eines der spannendsten. Thank you for your time.
Pleasure.
I said in my entrance, it would not be my last interview for Cannabis in this trip, but for sure it was one of the most interesting one. Then you are a total different size, first from the size, and also I like the concept that you're looking for the end product and the quality standards and so on. This is what I miss by some other companies that they don't look at what the consumer wants and the quality standards behind. And this is coming from your background, medical background. That
when you're making medicines, if you don't make quality medicine, nobody's going to use it, right? So it's so for us coming into it, this is easy stuff. It's not hard. If you were growing it in the basement, and then you're trying to all of a sudden, make medicines. It's a long learning curve. For us to be making medicine and then come into this space,
it's easier. Easier this way than the other one.
That's right. That's right. Well,
Thank you for the update.
Yeah, thank you, Joe. That was great. Appreciate it.